Okay. Good morning, dear students. Today I am taking about the contents of vertebral canal. In this topic of contents of vertebral canal, the different learning objectives of topic are introduction of topic in joints which are present in the vertebral column, different movements which are occurring on vertebral canal, contents of vertebral canal, spinal cord, meninges or coverings of spinal cord, in the structure of the spinal medulla, spaces which are formed adjacent to the meninges or coverings of spinal cord, cerebrospinal fluid and its circulation, and at last applied anatomy of topic. So first about the introduction of topic, contents of vertebral canal. So first about in short about the vertebral column. So all of you knows regarding the different vertebrae which are involved in the formation of vertebral column. The vertebral column in body is formed by 33 different vertebrae. These 33 amongst these 33 different vertebrae of vertebral canal, 7 are cervical, 12 thoracic, 5 lumbar, 5 sacral and 4 coccygeal vertebrae are present. All these vertebrae of vertebral column, these are connected with each other with the help of intervertebral joint. Among us, in between the adjacent vertebra, there is presence of the articular disc. The articular disc mainly consists of centrally nucleus pulposus and peripherally annulus fibrosus is present. This vertebral canal in the body, it allows the passage for spinal cord in the body. Now here all of you can see this is a vertebral canal formed by connecting the different vertebrae in the body. The anterior wall of vertebral canal is formed by bodies of different vertebrae. Intervertebral disc or articular disc between the bodies of adjacent vertebrae. Posteriorly there is presence of vertebral lamina and ligamenta flava, and on either side of the vertebral column there is presence of pedicels of vertebrae and intervertebral foramen. This is about the anterior and posterior walls of vertebral canal. Now after this, the different joints which are present in vertebral column. From above to below, the different joints which are present in vertebral column are atlanto-occipital joint, intervertebral joints. These are the different joints which are present in the vertebral column. Here, first about the atlanto-occipital joint. The atlanto-occipital joint is a ellipsoid type of a sinual joint. The atlanto-occipital joint is formed by the articulation between the occipital condyles present at the base of the occiput articulates with the superior articular facets of atlas by forming atlanto-occipital joint. The different ligaments which are present in atlanto-occipital joint are anterior atlanto-occipital membrane, posterior atlanto-occipital membrane and capsular ligament. These are the different ligaments which surrounds to the atlanto-occipital joint. The different movements which are occurring at atlanto-occipital joint are flexion, extension. These are the movements occurring. Then second, atlanto-axial joint. So here the atlanto-axial joint, in body there are 3 atlanto-axial joints. Among these 3 atlanto-occipital joint, centrally there is a median atlanto-axial joint, and on either side there is presence of a paired lateral atlanto-axial joints. That is medial and lateral atlanto-axial joints. The atlanto-axial joint, here all of you are able to see the atlanto-axial joint is formed between the atlas bone and the axis of cervical vertebrae. Among this one, the medial atlanto-axial joint is a sinual joint. The different ligaments which are providing support to atlanto-axial joints are apical ligament, which is attached to the tip of axis, capsular ligament, pair of alar ligaments and transverse ligament. These are the different ligaments which surrounds to atlanto-axial joints. The different movements which are occurring at atlanto-axial joint, mainly rotatory movement of head surrounding to axis occurs at the atlanto-axial joint. Then next, intervertebral joints. The intervertebral joints of vertebral column are formed by the articulation of different vertebrae. The intervertebral joints are example of a secondary cartilaginous joint. Here the bodies of different vertebrae, they articulate with each other by forming intervertebral joint. And adjacent, here you can see adjacent to the vertebrae there is presence of a articular disc. This is a white colored articular disc. The articular disc consists of centrally nucleus pulposus and peripherally annulus fibrosus is present in the articular disc. And the different ligaments which surrounds to intervertebral joints are anterior and posterior longitudinal ligament. Upper end of anterior longitudinal ligament is attached to anterior tubercle of atlas, and lower end extends up to the upper part of anterior surface of sacrum. While posterior longitudinal ligament, it extends from posterior surface of posterior arch of atlas up to the sacral canal. This is about intervertebral joints. Mainly flexion, extension, these movements occurs adjacent to intervertebral joints. Now after these joints, of vertebral column. Now regarding the curvatures. Here in case of the curvatures on the vertebral column, there is presence of the two curvatures, primary and secondary curvatures, which are present on vertebral column. The primary curvatures are present throughout the intrauterine life. Primary curvature is present mainly in thoracic and lumbosacral region, while secondary curvature of vertebral column is present in cervical and lumbar region of the vertebral column. Now after the curvature of vertebral column, about the different movements which are occurring in vertebral column. The different movements which are occurring on the vertebral column are flexion, extension, lateral flexion, rotation. These are movements occurring in vertebral column. The flexion and extension, these movements which are occurring on the vertebral column, these are more extensive in cervical and lumbar region. But these flexion and extension of vertebral column are restricted in the thoracic region because the articulation of the ribs with sternum and articular disc. In the cervical region, the flexion of vertebral column is chiefly produced by scalenus anterior, longus cervicis and sternocleidomastoid muscle. While in lumbar region, the flexion of vertebral column is produced by psoas muscles and rectus abdominis muscle. Then about the lateral flexion of the vertebral column. Lateral flexion of vertebral column is bending of body to the one or other side. Lateral flexion of the neck is chiefly produced by scalenus anterior and medius muscle. Also assisting muscles are sternomastoid and trapezius muscle. Then about the rotation. The rotation in the cervical region is a main twisting movement of the vertebral column. The rotation of the vertebral column is extensive in the axial joint, and rotation at the neck is mainly produced by sternocleidomastoid muscle on one side and splenius capitis on other side. This is about the movements occurring on vertebral column. Now after the movements, now about the contents of vertebral canal. Now here you can see this is a vertebral column which allows the passage for different structures which passes forward through vertebral canal are spinal cord, meninges or coverings of spinal cord, arteries which lies adjacent to the spinal cord, venous channels which forms the venous plexus adjacent to the spinal cord, pair of the spinal nerves and on either side of the spinal cord, then spaces which lies adjacent to the membranes or coverings of the spinal cord, cerebrospinal fluid, fat and loose connective tissue. These are the different contents of vertebral canal. Now about one by one regarding all contents of vertebral canal. So first and main important content of vertebral canal about spinal cord. So here all of you able to see this is a spinal cord which passes forward through the vertebral canal, and on either side of spinal cord here you can see these are paired spinal nerves. The spinal cord, it is a continuation of terminal part of the medulla oblongata of brain. The spinal cord is cylindrical, grayish white structure, and the length of spinal cord varies in case of adult male and adult female. Usually length of spinal cord in adult male is more, that is 45 centimeters, while the length of spinal cord is less in adult female, is about 40 centimeters. The spinal cord, it begins above the foramina magnum present on the norma basalis of cranial cavity, and in the lower part it extends through the sacral canal of sacrum. The termination of spinal cord is varies in case of young child, in adults, and in intrauterine life. The level of termination of spinal cord in case of adult is at the lower border of first lumbar vertebrae. Now here, during the intrauterine life, the spinal cord extends throughout the length of vertebral column. But after the birth, the length of vertebral column, it increases more as compared to the spinal cord. So the level of termination of spinal cord in case of young child is at the level of upper border of third lumbar vertebrae, while in case of adult the level of termination of spinal cord is at the level of lower border of first lumbar vertebrae. This is about variation in termination of spinal cord in intrauterine life, in young child, and in adults. Now after this, regarding functions of spinal cord, and on either side of the spinal cord there is attachment of 31 pairs of spinal nerves. So the spinal cord, it allows the attachment of spinal node and on either side of the cord. Then it allows the execution of simple reflexes, then the transmission of impulses to and from the brain. The spinal cord, it allows the passage for different descending and ascending tracts of body. These are the different functions of spinal cord. Then after functions of already I have told regarding little bit about the positional changes of a spinal cord as per the age varies in person. So up to the third month of intrauterine life, the spinal cord, it extends throughout length. Can after the birth, the termination of lower and first lumbar. In adult, specifically for clinical procedure known as lumbar puncture. Then after spinal, which surrounds at meninges of spinal cord, there is presence of the spaces. The different spaces which lies adjacent to these three different coverings or membranes of spinal cord, these spaces are epidural space, subdural space, subarachnoid space. These are the three different spaces and coverings of spinal cord. Now first about the outermost layer or membrane of spinal cord known as dura mater. So here in this PPT, here you can see this is known as a dura mater. This is a dura mater. Then here this is a arachnoid mater, and here you can see this is a thin transparent, this is pia mater covering to the spinal cord. The dura mater of spinal cord consists of two layers, endosteal layer and meningeal layer. These are the two layers present in dura mater. And the dura mater layer is a strong fibrous sheet-like membrane which extends up to the cauda equina of spinal cord. The cauda equina of spinal cord is lower terminal tail-like projection extending from the conus medullaris of spinal cord. The dura mater of spinal cord is continuous through the foramen magnum with the meningeal layer of dura mater covering to the brain, and inferiorly the dura mater of spinal cord, it ends on the filum terminali at the level of lower border of second sacral vertebra, and deep to the layer of a dura mater a space formed known as above to the layer of a dura mater one space is formed known as epidural space. The epidural space which is present outside the dura mater of spinal cord mainly consists of fat, loose areolar connective tissue and internal vertebral venous plexus. Now after the dura mater, now about second covering of spinal cord, about arachnoid mater of spinal cord. The arachnoid mater of spinal cord is a delicate semi-permeable avascular membrane surrounding to the spinal cord. The arachnoid mater surrounding to the spinal cord is separated by a layer of dura mater by a space known as subdural space. The layer of a arachnoid mater is separated from third and innermost layer known as pia mater by a space known as subarachnoid space. The subarachnoid space is usually filled with cerebrospinal fluid. Then after arachnoid matter, now the innermost membrane or covering of spinal cord known as pia mater. The layer of a pia mater is a vascular membrane which closely invests the spinal cord. In the lower part, the pia mater fuses with the phylum terminally present at the lower part of spinal cord. The pia mater, this layer of a pia mater is thickened, and on either side of the spinal cord between the nerve roots, these are the nerve roots of spinal nerves, by forming the ligamentum denticulate. So here you can see this is a triangular projection known as a ligamentum denticulata. The clinicians gave given the name for the space which lies adjacent to this one is a arachnoid mater and the pia mater, known as subarachnoid space as a intrathecal space. This layer of pia mater, it gives rise to the special parts. These special parts which are extending from the pia mater, also known as processes of pia mater. These processes of pia mater are one phylum terminally. So here you can see this is a terminal conical narrower end of spinal cord known as a conus medullaris, and here it gives rise to the one terminal narrower part known as a cauda equina, and on either side there is presence of a phylum terminally. Subarachnoid septum, linea splendens and ligamenta denticula. These are the special parts of pia mater. Among these, the phylum terminally usually possesses the length of 20 centimeters. It extends from the terminal, it extends from and on either side of conus medullaris. The phylum terminalis mainly consists of non-nervous tissue along with lower 4 sacral nerves, lower 5 coccygeal nerves are present in phylum terminally. The phylum terminally possesses the horse tail-like appearance. Then subarachnoid septum. The subarachnoid septum extends from the dorsal surface of spinal cord. Then ligamenta denticulata. So here you can see this is known as a denticulate ligament or ligamenta denticula. These ligamenta denticulatum or denticulate ligament of spinal cord, these are ribbon-like thickened bands of the pia mater. These denticulate ligaments, this extends, and on either side of the spinal cord, the anterior and the posterior roots, the terminal ends of anterior and posterior roots of spinal nerves are present in the ligamenta denticulata. The ligamenta denticulata, it serves as a guide for neurosurgeon, specifically in cordotomy operation. Then after these 3 coverings of spinal cord, now the next content of vertebral canal about the spaces which are present adjacent to these 3 meninges or coverings of spinal cord. The 3 different spaces which are present adjacent to these meninges or coverings of spinal cord, these spaces are epidural space, subdural space and subarachnoid space. These are the 3 different spaces lying adjacent to meninges or coverings of spinal cord. Now the one by one regarding these three spaces present adjacent to meninges of spinal cord. Now first about epidural space. So the epidural space, is lies above to durameter of spinal cord. The epidural space of spinal cord is usually filled with fat, spinal arteries, loose areolar connective tissue and internal vertebral venous plexus. These are the contents of epidural space. Mainly in the epidural space of spinal cord, the epidural block is given. Then the next space known as subdural space. As per the name of this space is a potential space between the dura mater and arachnoid mater. So this is a subdural space. The subdural space permits the movement of dura mater over the arachnoid mater. Now after this subdural space, next space known as subarachnoid space. The subarachnoid space lies between the arachnoid mater and the pia mater of spinal cord. The peculiarity of subarachnoid space is the space is filled with the cerebrospinal fluid. The subarachnoid space is wider adjacent to the spinal cord as compared to that subarachnoid space present surrounding to brain. Then after this spaces, now regarding in short about the external features present on spinal cord. In case of the external features which are present on spinal cord, the spinal cord consists of anterior and posterior surface. The anterior surface possesses one centrally fissure is present known as the anteromedian fissure, and on either side there is presence of the anterolateral sulcus. Posterior surface possesses the three sulcuses: posterior median sulcus, posterolateral sulcus and posterior intermediate sulcus. These are the three different sulcuses present on posterior surface of spinal cord. Then spinal nerves, and on either side of spinal cord there is presence of 31 pairs of paired spinal nerves are present. The paired spinal nerves consist of an anterior root and posterior root. Then there is presence of cauda equina and phylum terminally. The cauda equina is a tail-like projection. Cauda equina and phylum terminally. Phylum terminally is formed by lower sacral coccygeal nerves and cauda equina. The cauda equina and phylum terminally, these are present at the lower end of conus medullaris of spinal cord. Then next, if this is about the external features, then about the internal structure of spinal cord. Now here in case of internal structure of the spinal cord, if the transverse section has taken through the spinal cord, what are the features which are seen in the internal structure of spinal cord? Now in the internal structure of spinal cord, that consists of a centrally presence of a grey matter and peripherally white matter. And in the central part of grey matter there is presence of a smaller rounded central canal is present. The amount of gray matter is maximum in thoracic and lumbar region of spinal cord. The gray matter of spinal cord, it consists of mainly neuroglia, nerve cells or neurons. The nerve cells or neurons lying in the gray matter are sensory neurons, motor neurons, Golgi type of the neurons and blood vessels. These are the constituents of gray matter, which lies adjacent to the central canal. This is the central canal. Here this is the gray matter and peripherally white matter of spinal cord. The gray matter of the spinal cord consists of anterior and posterior gray column, then gray commissures and lateral gray column. Then about white matter of spinal cord. The white matter of the spinal cord, it lies in the peripheral part. The white matter of spinal cord mainly consists of myelinated nerve fibers. The amount of white matter of spinal cord, it increases from below to the above of spinal cord. The different contents of white matter are mainly the fibers, the different type of the fibers which are present in white matter of spinal cord. These fibers are one, sensory fibers, in motor fibers and association fibers. These are the three different type of the fibers present in white matter of spinal cord. The sensory fibers of white matter mainly consist of central processor of primary sensory neurons. Then it consists of ascending fibers from nuclei of spinal gray column. Then second type of the fibers present in white matter known as motor fibers. The motor fibers which are present in white matter of spinal cord mainly consist of descending fibers arising from the higher centers. Then third type of the fibers known as association fibers. The association fibers originates and end with the spinal cord. Now after the internal structure of spinal cord, now next content of vertebral canal, about the arteries which are present adjacent to spinal cord. The arterial supply to the spinal cord is mainly through anterior spinal arteries, in posterior spinal artery and segmental arteries. Among which here you can see this is the anterior spinal arteries. These arises from spinal branches of vertebral arteries. The anterior spinal artery, it runs through the anterior median fissure. So here you can see this is the anterior median fissure through which the anterior spinal artery runs forward. The anterior spinal artery, it provides the arterial supply to the anterior 2/3 of anterior aspect of spinal cord. Then posterior spinal artery. The posterior spinal artery, these are also the branches from vertebral arteries. The posterior spinal arteries runs through the posterior aspect of spinal cord. Posterior spinal artery, it supplies to the lower 2/3 of posterior aspect of spinal cord and segmental arteries. These segmental arteries, they forms the radicular arteries. Now after these arteries which are lying adjacent to the spinal cord, now the next content of vertebral canal, about the veins lying adjacent to the spinal cord. Adjacent to the spinal cord, there is presence of the 6 longitudinal venous channels are present. These 6 venous channels, they drains finally into internal vertebral venous plexus. These 6 venous channels paired anterolateral, then paired anteromedial venous channels, and these venous channels which are present and on either side of the spinal cord, these are the tortuous in nature, and superiorly these venous channels, they communicate with the veins of the brain and drains into the cavernous sinus. Inferiorly, these longitudinal venous channels, they drains into the internal vertebral venous plexus. So here you can see these are the internal vertebral venous plexus which are formed adjacent to the spinal cord. The next content of vertebral canal about the spinal nerves. Adjacent and on either side of the spinal cord there is presence of 31 pairs of spinal nerves. Among these 31 pairs of spinal nerves, the distribution of the spinal nerves is in cervical, thoracic, lumbar, sacral, coccygeal region. So in cervical region there is presence of the 8 cervical nerves. In thoracic there is presence of the 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 sacral nerves, and a pair of coccygeal nerves. Each spinal nerve of spinal cord consists of an anterior and posterior root, among which here this is the anterior root. So here you can see these are the paired spinal nerves, among which the anterior root is motor root and posterior root is known as a sensory root. Anterior root of the spinal nerves is connected with the spinal cord by the series of rootlets, while the posterior root is sensory in nature. Now after these spinal nerves, now regarding the next content of vertebral canal known as cerebrospinal fluid. The amount of cerebrospinal fluid in body is about 130 milliliters. Among the 130 milliliters of cerebrospinal fluid, the 30 milliliters of cerebrospinal fluid is present in ventricular system of the brain, and rest amount is present in the subarachnoid spaces. The cerebrospinal fluid is a clear colorless fluid. This fluid is mainly secreted by the choroid plexus present in the lateral, third and fourth ventricles of brain. The circulation of cerebrospinal fluid occurs from third ventricle, from lateral ventricle to the third ventricle, then from third to the fourth ventricle. First, the cerebrospinal fluid is produced by choroid plexus of the lateral ventricle. From the lateral ventricle, it passes through the interventricular foramina into the third ventricle. From third ventricle, the cerebrospinal fluid passes through the cerebral aqueduct into the fourth ventricle. This is a fourth ventricle. And from the fourth ventricle, the cerebrospinal fluid, it circulates through the central canal and into the subarachnoid space. This cerebrospinal fluid, it helps for removing the waste products associated with neuronal activity. The cerebrospinal fluid, it acts as a shock absorber. Then it provides the nutrition to the brain and spinal cord in the body. Then after all these contents of vertebral canal, the last part about applied anatomy of topic. Now here in case of applied anatomy of topic, first about lumbar epidural anesthesia. So here in lumbar epidural anesthesia, so here the anesthetic agent is given with the help of a spine needle. For this purpose of injecting the anesthetic agent, the needle is passed between the third and fourth lumbar vertebrae. This space, this epidural space is confined by the fact that it's a space with the negative pressure. So here in the epidural space, in this way, the epidural, so here is the epidural space where this one is the epidural anesthetic agent is given, which is known as a epidural block. Then next about epidural, next lumbar puncture. So the lumbar puncture is a procedure where the cerebrospinal fluid is aspirated. This procedure known as lumbar puncture, it possesses the diagnostic and therapeutic value. The lumbar puncture, the site for the lumbar puncture is done in case of adult, specifically the space between the third and fourth lumbar vertebra. During this procedure, the patient lies either in the sitting position or in left lateral position. During this procedure, this one is a needle is injected through the space between third and fourth lumbar vertebra, and aspiration of the cerebrospinal fluid is done, and the examination of cerebrospinal fluid is done specifically for examination of the pus cells, proteins, level of protein in cerebrospinal fluid. The lumbar puncture in case of the children usually done at the level of first lumbar vertebra. So here you can see this is a spine needle carried out for the purpose of lumbar puncture and for the collection of cerebrospinal fluid. Then next about the importance for ligamentum denticulate. So here you can see this is a thin, transparent, triangular. This is known as a ligamentum denticulate or known as a ligamenta denticulata. This ligamenta denticula is a special process extending from the pia mater. The ligamenta denticulata acts as a guide for neurosurgeon during the cordotomy operation. Then after syringomyelia. What is syringomyelia? The syringomyelia is a clinical condition in which the fluid cavities or the cavities are developed near the center of spinal cord, known as syringomyelia. So in this clinical condition syringomyelia, mainly the central canal of the spinal cord is affected. Then after syringomyelia, last about the Brown-Séquard syndrome. So here The Brown-Sequard syndrome mainly occurs due to hemisection of spinal cord. So in this syndrome there is a ipsilateral upper motor neuron paralysis, then contralateral loss of vibrational senses occurs in Brown-Sequard syndrome. Then abnormal curvatures present on vertebral column. The different abnormal curvatures which are present on vertebral column are kyphosis, lordosis and scoliosis. The kyphosis, also known as a hunchback. The kyphosis, this occurs mainly due to the collapse of one or more vertebrae, then pathological erosion of vertebrae and congenital deformities of vertebrae. Then lordosis of vertebral column. In lordosis there is attenuation occur in the lumbar curvature of vertebral column, and at last scoliosis of vertebral column. So here in scoliosis of vertebral column there is a exaggeration occurs in the lateral curvature of vertebral column. So this is all about the clinical anatomy of contents of vertebral canal. Thank you.
Okay. Register.